A piece of your brain the size of a grain of sand may contain thousands of neurons and millions of synapses all talking to one another.
Welcome back. Here at the East Kentucky Science Center, visitors enjoy the back and forth exhibit, which allows them to see how the brain controls things we take for granted, like balance. Earlier in the program, we introduced you to a young woman who isn't able to experience many of the things most of us take for granted, like holding down a job or driving a car. Tila Ogline and her family were hoping brain surgery would give her a taste of freedom for the first time in 23 years. Let's check back in now with Helene Gleason.
For the past 23 years, Tila's family has hoped and prayed that advancements in medicine would one day lead to a cure to her debilitating seizures. Now, just 6 weeks after her trip to the operating room, let's check in on Tila and see how surgery at Memorial has changed her life.
It's a miracle. That's all I can say is it's a miracle. Because I've never ever expected Tila to be, I expected some difference, but I didn't expect a whole lot. And the day after surgery, she was completely different. And it was just amazing to me at all. It's just a complete miracle.
Well, first off, she hasn't had any seizures at all. And Tila averaged 2 to 4 seizures a month with medication. And now we're talking no seizures. She's very alert. She seems to be more conscious of what's going on around her.
While Tila, like many people, gets very nervous on camera, she is anything but in real life. On my first visit, I met a very quiet young woman who seemed a bit confused. However, just weeks after surgery, as soon as I arrived, I noticed a difference in Tila. So how does Tila feel about her results?
It makes me feel like a better person. Before surgery, I barely wanted to do much of anything. I was more tired. I barely wanted to walk. I barely wanted to do anything. Before, I didn't know what was going on. It was harder for me to know what was going on from day to day, and now I'm more alert than what I was before.
Utilizing the advanced testing available through Memorial's comprehensive epilepsy program, coupled with the computer-guided surgical technology, Dr. Bowles was able to give Tila a new lease on life.
That's the area which really causes the seizures, and we're able to carefully remove that with the microscope and special instruments, cavitronic, ultrasonic, surgical aspirators, to just carefully remove the tissue but preserve all the important brain tissue. And we're able to successfully do that. And she's done real well after surgery. She not only doesn't have any more seizures, but her mental functioning is much better. She's much brighter. She's much more responsive. And now that she doesn't have these seizures that further damage her brain, she's a much happier patient, a much happier person.
Day in the hospital, day after it happened, she just kept going on and on about how thankful she was that she did this. And since the surgery, she hasn't had a seizure at all. And she keeps asking, did I have one today? Did I have one today? Did I have one today? And I said, no, you're good still. She goes, oh, that's great. I'm so happy.
You shouldn't deprive yourself of an opportunity to cure yourself of this devastating disease. Do you need to go to Pittsburgh? Absolutely not. Do you need to go anywhere else other than what we have here? No, because we have all of the technology, we have all of the expertise. It doesn't make a whole lot of sense to have your surgery done someplace else because you're going to need to have your follow-up there. It makes every bit of sense to have the surgery done here, close to family, close to physicians who can take care of you.
Over the course of the next several months, the plan is to slowly wean Tila off of her medications, with the goal of keeping her seizure-free. But for now, Tila, her family, and caregivers are just pleased with her progress and excited to see what the future holds for this young woman.
Tila has been dealt not the greatest hand in the world to work with, and I think that in the past 6 weeks at least, there's a huge promise for Tila that only family members saw in her.
She's much more interactive, she's much brighter, she's engaging, and right now she can make up everything she's lost. And I think she will with the right incentive, and she's very eager to do that. So I think her prognosis and her outlook is excellent.
We're pleased to report that Tila continues to do well, and so far continues to be seizure-free. We do want to mention it was a very special friend of their family that encouraged Tila to share her story in the hopes of helping others with epilepsy. That special friend was former TV weatherman Steve Richards, who has since passed away from heart disease. Steve was 54 years old. Tila and her family asked us to take this moment to encourage others to pay attention to the signs and symptoms of heart disease. For more information on the treatments and technology highlighted here today, log on to our website at www.conemaugh.org or call our Nurse Connection at 1-800-587-5875. Unfortunately, that's all the time we have for today's program. Our special thanks to the East Kentucky Science Center and to Evergreen Exhibitions for allowing us to explore Brain, the world inside your head. Until next time, from all of us in the Conemaugh Health System, we wish you good health. Thanks for watching.